Testosterone replacement therapy, myths versus facts. Welcome back to the channel, everyone. Today we're diving deep into one of the most controversial topics in men's health, testosterone replacement therapy, or TRT. If you watched our last video about erectile dysfunction medications, you know how much misinformation exists around men's sexual health. Well, testosterone therapy is even more misunderstood. The internet is flooded with both miracle claims and horror stories, making it nearly impossible to know what's actually true. Here's what might surprise you. Studies show that 40% of men over 45 have low testosterone, yet most don't even know it. Why? Because the symptoms are often dismissed as just getting older or being stressed. Last month, medical professionals encountered a case with Tom, a 42-year-old marketing executive who came in completely exhausted. "Doc," he said, "I can barely get through my afternoon meetings without falling asleep. My wife thinks I'm not attracted to her anymore, but honestly, I just don't have the energy for anything." Tom's testosterone levels were 280 nanograms per deciliter, well below the normal range of 300 to 1,000. But like many men, he'd been told by healthcare providers that his symptoms were just part of aging. Today, I'm going to separate fact from fiction when it comes to testosterone therapy. We'll cover who's actually a candidate, what the real risks and benefits are, and most importantly, how to know if TRT might be right for you. Let's start with the most dangerous myth. Testosterone therapy causes prostate cancer. This fear has kept countless men from seeking treatment, but it's based on outdated research from the 1990s. Recent comprehensive studies have shown no connection between properly administered TRT and increased prostate cancer risk. Here's what we know now. Testosterone doesn't cause prostate cancer, but it can potentially accelerate existing cancer. That's why proper screening is crucial before starting treatment. We do PSA blood tests, digital rectal exams, and sometimes imaging to ensure it's safe to proceed. Think of it like this: testosterone is like fertilizer for grass. It doesn't create grass, but it helps existing grass grow. Same principle applies to prostate health. Moving to the second myth. TRT is just for bodybuilders and athletes. This couldn't be further from the truth. While some athletes do misuse testosterone, legitimate TRT is for men with clinically diagnosed low testosterone who want their sleep, energy, focus, and libido back. The men I treat aren't looking to bulk up for competitions. They're accountants, teachers, engineers, and fathers who want to feel like themselves again. They want energy to play with their kids, focus for important work meetings, and intimacy with their partners. James, a 50-year-old high school teacher, reported 6 months after starting TRT. "I feel like I've gotten 10 years of my life back. I'm not dragging myself through each day anymore." The third myth we need to address. Testosterone therapy will shut down your natural production forever. This one's more complicated because there's some truth to it, but the full picture is different than most people think. Yes, when you take external testosterone, your body's natural production does decrease. Your testicles essentially go into sleep mode because they detect adequate testosterone levels. However, for most men, natural production can resume when TRT is stopped, especially with proper medical supervision. That said, many men who truly need TRT have already lost significant natural production due to aging, medical conditions, or other factors. For these men, TRT isn't shutting down healthy production, it's replacing production that was already compromised. Now for the fourth myth. You'll see results immediately. I understand the desire for quick fixes, but testosterone therapy is a marathon, not a sprint. Most men start noticing improvements in energy and mood within 2-4 weeks. Changes in body composition, increased muscle mass, and decreased fat typically become noticeable around 3-6 months. Sexual function improvements can vary widely, sometimes appearing within weeks, other times taking several months. Tom, the marketing executive I mentioned earlier, started feeling more energetic after 3 weeks, but it took nearly 4 months before he felt completely like his old self again. The fifth myth is probably the most pervasive. Testosterone therapy is dangerous for your heart. This myth gained traction from some poorly designed studies, but recent research tells a different story. In fact, the FDA recently removed the black box warning from testosterone products after reviewing large clinical trials that showed no increased cardiac risk. Current evidence suggests that normalizing low testosterone levels may actually benefit cardiovascular health. Low testosterone is associated with increased risk of heart disease, diabetes, and metabolic syndrome. However, this doesn't mean TRT is risk-free. Men with existing heart conditions need careful monitoring, and the therapy should always be supervised by qualified healthcare providers. Now that we've debunked those myths, let's talk about who might actually benefit from testosterone replacement therapy. The ideal candidate is a man with clinically low testosterone, typically below 300 nanograms per deciliter, who's experiencing symptoms that affect his quality of life. This isn't about optimizing already normal levels, it's about treating a legitimate medical condition. Good candidates often have symptoms like persistent fatigue that doesn't improve with rest, decreased muscle mass despite regular exercise, low libido, mood changes like irritability or depression, and difficulty concentrating. However, you're not a good candidate if you have a history of prostate or breast cancer, severe heart failure, untreated sleep apnea, or if you're planning to have children soon, as TRT can temporarily affect fertility. Here's what the treatment process actually looks like. First, comprehensive testing is essential. This includes multiple testosterone measurements, preferably taken in the morning when levels are highest, along with other hormone tests, blood count, liver function, and prostate screening. If TRT is appropriate, you'll work with your doctor to choose the best delivery method. Injections are typically given every 1-2 weeks. Gels are applied daily to the shoulders or thighs. Patches are changed daily, and pellets are inserted under the skin every 3-6 months. Regular monitoring is crucial. You'll need blood tests every 3-6 months to check testosterone levels, red blood cell count, and prostate markers. This isn't a set it and forget it treatment. Let me share another success story. David, a 55-year-old construction foreman, came to me feeling like he was running on empty. His testosterone was 240, and he was struggling to keep up with the physical demands of his job. 6 months after starting TRT, David's energy returned, his strength improved, and his relationship with his wife flourished. But more importantly, his overall health improved, his cholesterol levels normalized, and he lost 25 pounds without even trying. Here are my key recommendations for anyone considering testosterone therapy. First, work with a qualified healthcare provider who specializes in hormone therapy. Not all doctors have experience with TRT, and proper management requires specific expertise. Second, get comprehensive testing before starting. Don't rely on online, low-T quizzes or single blood tests. You need a complete hormonal and health evaluation. Third, have realistic expectations. TRT isn't a fountain of youth, and it won't solve every problem. It's a medical treatment for a specific condition. Fourth, commit to the monitoring process. Regular blood work and checkups aren't optional, they're essential for safe, effective treatment. Fifth, consider lifestyle factors too. TRT works best when combined with proper nutrition, regular exercise, adequate sleep, and stress management. Testosterone replacement therapy can be life-changing for men with clinically low testosterone. But like any medical treatment, it requires careful evaluation, proper supervision, and realistic expectations. The key is finding a healthcare provider who will take the time to properly evaluate your symptoms, run comprehensive tests, and develop a treatment plan that's right for your specific situation. Remember Tom from the beginning? 8 months later, he reported, "I finally feel like myself again. My energy is back, my marriage is stronger, and I'm actually excited about life again." That transformation is possible, but it requires the right approach. If you're experiencing symptoms that might be related to low testosterone, don't ignore them. And don't try to self-diagnose based on internet articles or advertisements. Get proper medical evaluation from a qualified provider. Thanks for watching today's video. If you found this information helpful, please give it a thumbs up and subscribe to our channel. We're committed to providing evidence-based health information for everyone, covering topics that matter to both men and women, from hormonal health and sexual wellness to nutrition, fitness, mental health, and preventive care. Drop a comment below if you have questions about today's topic, and let us know what health topics you'd like us to explore next. Our goal is to break down complex medical information into practical insights that help you make informed decisions about your well-being. We'll see you in the next video with more health content that matters to you. Until then, take care of yourselves.